Okay, guys, we have about 2 lectures left. I'm going to go through the lymphatic system relatively quick. As always, I'm going to kind of give you the highlights of what I think are the most important aspects of this lymphatic system. And really, we're just going to go over how the lymphatic system works in unison with the immune system. We'll talk about COVID a little bit since that's a highlight going on right now. And maybe some other things, some other pathologies such as like cancer and things like that, and how the lymphatics plays a role with the immune system in protecting the body. So first off, the lymphatic system, we think of the lymph vessels, and most oftentimes you guys probably know the lymphatic system through the lymph nodes. If you've ever gone to the doctor and you were sick and the doctor felt the lymph nodes in your neck to check and see if they were swollen, you probably recognize the lymphatic system through that way. Well, the lymphatic system is actually similar to our cardiovascular system in that it is somewhat of a highway, structures of highways, lymph vessels that provide a means for transportation of lymphocytes, phagocytic type cells, bacteria, broken up bacteria, broken down viral tissue and RNA structures, all to then be shelled off and excreted either through our kidneys or maybe detoxified in our liver, and then eventually excreted out of the body. So the lymph system and the immune system also plays a major role in dealing with broken down protein structures that are associated with exercise science, such as heavy weightlifting or just a musculoskeletal injury like a lateral ankle sprain. The lymphatic system plays a role in fluid reduction and protein structure breakdown, or any types of structures or necrotic tissue, dead tissue that needs to be shuttled away. So here you can see the major components. The tonsils are a part of the lymphatic system. The thymus gland we put as part of the lymphatic system because the thymus gland plays a role in the immune system, plays a role in helping us to fight off viruses. The spleen is sort of like a major warehouse of immune system properties. Okay. Lymph nodes are like tiny little warehouses, and then the lymph vessels are what connect everything and provide that highway transportation. So the circulation of flow of the lymphatic system. The lymphatic system, one of the errors of the lymphatic system is how close that it goes through to the heart and has a connection with the heart. So yes, we do want waste products and different types of substances that are foreign that may be passing through the heart to then enter the lymphatics and be shuttled out. But one of the flaws in the lymphatic system is the potential for triglycerides in the lymphatic system to be dumped in and around the heart, specifically in the coronary arteries, which that can then tend to lead to atherosclerosis, which is fatty acids, triglycerides being trapped and causing plaque buildup in the coronary arteries. So that's one of the downfalls of the lymphatic systems. But this slide here gives a good little brief overview of the circulation of flow. You need to know this, especially for your exam, so review this one. Okay, so this slide is going over what I've kind of already talked about, how lymph is delivered from the trunks into one of 2 large lymphatic duct systems. This is sort of the initial duct systems that occurs. Each duct then empties into venous circulation. So basically into the internal jugular and subclavian veins. All right, and then it's then shuttled throughout the cardiovascular system, and then eventually gets excreted. All right, so this is just a good image of the lymphatic duct network here. Okay, let me get my little pointer tool out. Okay, I'll just use my draw tool. All right, so this is kind of this junction point here where the lymphatics then dump into the subclavian venous return right here in this junction, or right here. But the lymphatic flows up through. The more we move as human beings, our lymph vessels are placed strategically around gross large muscles, as you can see here for the upper limb, here for the lower limb. But the more we move, lymph flow moves in an upward fashion. Okay. Collects here. Here's our spleen, really large warehouse, giant organ of the immune system. And then eventually comes up and collects into these ducts here and empties into the subclavian or internal jugular venous return, and then gets shuttled out for excretion. A few things that are important is the lymph nodes. So you can see all the lymph nodes. These are the ones that are most commonly recognized. Okay, our cervical lymph nodes, mostly because that these lymph nodes here are the ones that a physician will palpate, or a PA or an NP will palpate when determining what type of maybe sickness or pathology we have. It just gives them one other sign as to aid in the addressing sign and symptoms for determining pathologies. Lymph nodes down here can sometimes be swollen if you have maybe a urinary tract infection or some type of UTI. Well, that is a urinary tract infection, or some type of STI, better said. And then oftentimes here we check our lymph nodes for females, also for males, although less common in males, but for breast cancer. So these are the lymph nodes. The axillary lymph nodes are what they tend to check and make sure that are not swollen or do not have any differentiated cells or potentially cancerous cells within these tissues here. If there are, then that's kind of a warning sign, and we tend to remove those lymph nodes. And then check for potential cancerous cells that may be moving throughout our lymphatics and our cardiovascular system. So we don't want it to get into the bloodstream. That's bad. Okay, so like I said, our lymph organs. We have the MALT, and we'll talk about these types of tissues, the mucosa-associated lymphoid tissues. These MALT tissues, there's several different types. The lymph nodes, or excuse me, the tonsils. We have several tonsils in our larynx and pharynx areas, our laryngopharynx areas, that play a role in protection and immune system activation for any sort of respiratory illness, upper respiratory, lower respiratory, or rhinoritis, or anything like that. Our Peyer's patches, these are very similar to the tonsils, but they are found throughout our digestive system, along our small intestines, and help to provide some immune protection for any sort of gastrointestinal issue. And then lastly, our appendix supplies some secretion, although our appendix doesn't do much, but it still does some type of ancillary work with our immune system. Okay, so here's our Peyer's patches. You can see that they're throughout our small intestines, our appendix. Our thymus gland is kind of the control center for all and connects up into our brainsicle, our brain, okay? And a good communication between the two help for control of our immune system. Our tonsils in our throat and mouth region help to protect for any sort of respiratory. This down here, Peyer's patches, helps to protect, provide immune support for gastrointestinal issues. Our spleen is a main powerhouse of the body for immune protection. And then our red marrow. Our red marrow is very important. If you remember our red marrow, this is where hematopoiesis occurs. Well, it is also where white blood cell creation occurs. So all the mitosis and leukopoiesis occurs in red bone marrow as well.